All right, I think we're up and online now, so we'll go ahead and get started. Our August 19th Child Welfare Task Force meeting, and I want to thank everybody for taking time out of their day to be here. We'll go ahead and introduce ourselves. I'm Dale Devon, State Representative from District 5, St. Joe County, home of the Fighting Irish, and we'll just go around the room this way. Emma?
I'm Emma Blackwell, Youth Representative.
Jeff Helm, Youth Opportunity Center.
Harmony.
Janine Jacobs with Family Art. Shannon Schumacher with Villages.
Gordon Evansville, House 677.
JD Ford, Senate District 29, Marion, Boone, and Hamilton counties.
Nathan Samuel, Child Place, Child and Family Services.
Tina Clore, Firefly Children and Family Alliance.
Sarah Sailors, Division of Mental Health and Addiction.
Julie McGuire, House District 93, Indianapolis.
Dana Kenworthy, Court of Appeals.
And Mark Fairchild, Commission on Improving the Status of Children.
Very good. Thank you. And I know Director Dorfmeyer wanted to be here, so she brought her better half, their chief of staff with Harmony. And Harmony, if you want to go ahead and run with the ability to pull population, if you want to speak on that just a little bit.
Sure. I'm not sure if this is working. Can you guys hear me? Oh, I think we were doing it wrong. Okay. Put me in charge. So just a quick update, and I apologize, I don't have the full context of the conversation or maybe the interest, but just it's no secret in DCS, data has been a little bit of a challenge over the years. Just we lack a little bit of the technology to be able to track and pull data accurately and consistently. We have a great way in which we do it. So currently we're working on just ensuring that all data requests go through a governance committee so that we are working through a consistent lens in an accurate vetting the data. We have a three-step process to that where our data team does vet the data when it's requested. We do have a team that looks at that for accuracy. When you look at the child population or any population, we are able to track various demographics, age, race, sex, and on. We do sometimes struggle with a duplicate profile and then a few other things therein. So the things we track within our system, we are limited to those only until we modernize, meaning every new request that we do not already track is considered an enhancement to the system. Therefore, comes with not just a price tag, but a decent amount of time to enhance that system to be able to track it. So right now what we're doing is working on our plans for our modernization system so that we can scope out all requests we've had over the last couple of years, plus what we consistently need to provide so that the new system will accurately collect the information on all children and families and be able to pull that into a report easily. Is that kind of the updates you need,
Thank
Representative?
you. Any comments or questions from committee members? Senator?
Yeah, thank you, Mr. Chair. Thank you for that report. You mentioned a little bit about the lack of the technology. So what would DCS need in order to make that happen?
Quite frankly, money. So technology modernization requires money. We do have great ideas. We've been working with our federal partners, ACF, on the national practices around modernization. We are at all of the roundtables, the conversations. We're learning what's out there, what works, what other states struggle with. Right now, what they've done is move towards modular based, meaning you do not have to have a full system replacement in order to start enhancing your system. So we have kind of scoped out which modules we need and in which order. And so we're approaching it that way. I think our plans right now are to kind of do an RFI, see what systems people can do for us. What are the vendors able to do? And then work towards buying a product and partnering with someone to do that.
Thank you, Mr. Chair. So what I'm hearing you say is that modules. So like a platform or a database or a clearinghouse, is that kind of what you were intending or?
Yeah, so most of the software companies can build you something on a platform, and the module base means you're starting with a piece of the work. So in child welfare, that could look like we have a module that's our intake. So that's when you call the hotline. That would be considered a module, the intake process by taking the information and assigning it out. The next module could be what we call assessments. Assessments are where we are going out there and investigating abuse or neglect, and that houses all the information thereof. Is the child safe or not? What information, what evidence, what are we finding? Another module can be foster care. So foster care system and houses all the information about each license that is out there. Another module could be our eligibility. So every child that we remove from home and work with the family, we run what's called eligibility to see if we can draw down federal funds. That is a module by itself.
Okay. So it sounds like maybe like a customer service platform to kind of track to see all this. Is that what I'm
Yes.
hearing? Okay.
Mhm.
And then maybe that just kind of answers my next question, but what type of requests are you currently receiving but can't complete because of the technology
They're
deficit?
just very nuanced, right? So
Okay.
I want this particular piece of information cross-referenced with another one that our system maybe just doesn't do, and that
Mhm.
requires me to assign it to someone to manually go in and then run spreadsheets against each other.
Gotcha. Okay. Thank you.
And this is something that we've been talking about for a couple of years now, and I think it's
Mhm.
very critical in a lot of different areas of DCS, especially for placement when you got an out-of-county service availability, but yet we want to try to keep kids close to home as much as possible as far as relatives or visitation and that type of stuff. But when you have somebody in, say, Hamilton County and they're placed in Gary, it's doesn't make sense sometimes.
Yeah.
But because of what their services are needed, that's the only place they could find it. But maybe there's something close by that would maybe serve them as well.
Yeah.
So
Mr. Chairman, or maybe you meant to answer, like what type of monetary, money are we talking here? $1 million, 20 million? I mean, I know you'll have
Closer to 20.
information with the RFIs going out, but
So it has been vetted, and we have a decent idea of how much it would cost to be successful in this space, and it is in our change package for our next biennium. But it is upwards of, I think, 15 to 30 million.
how many would that be? A one-time cost or a yearly?
Great question, and I would have to check.
Okay.
I do think just to lift it up, it is that all of them do have an ongoing cost, but there are some great processes that don't have a very heavy annual, and it's more of the lift of building. Some of the vendors do have a heavy annual, and so we would have to scope that out and decide which one is best.
Representative Burton?
Oh, thanks. Just kind of going on that, as you're going through the exploration piece of this, are you looking at modulars or platforms that could then talk with, say, school systems or healthcare services, things along those lines? That way you all aren't having to continuously input the same data over and over.
Correct. Yes.
Okay.
Yes, we are. And we have some DSAs out there now to try to help us integrate the same data across the board from schools. Department of Education and I have met, and we've looked at what they already capture. And they have a student ID, as you all know, and we've even talked about, can we then capitalize on that and assign it in preschools, and so at an even younger age to kind of lower the amount of children that don't have that information tracked once they're in school, so it can leverage that. We also are working right now on DSAs and working with iHigh so that we can get health information for all of our children and families, so that we are not chasing that and doing duplicative input. So we do have a lot of kind of irons in the fire that way, so that we can get as much information that's already out there as possible, so that one, it's accurate and we all have the same playbook.
Harmony, I would, along that same lines as those questions, I'd encourage the thinking through, like maybe connecting the data with our CMHCs and our CCBHCs as you build that out. And then obviously foster parents having access to the modules that would be, helpful for them to be able to care for those kids up front, right? When there's just not a lot of information that the FCM has in their hands when they're dropping kids off. So
Yeah, we have
I think that
actually
would be a
had
great-
some amazing kind of brainstormed and looked at some ideas where the module that would be foster care, but also integrate the health information would be a shared app with foster parents in real time.
While we're on this subject, I think everybody got a copy of, there's probably 2 or 3 pages here that's in the topic of a potential study topic drafts. So, every year legislators do summer study committees. And we have ours for family and children that has to do a fatal review report study, and that comes up next month. But we've been working with DCS, and I'm going to call her out again. Madeline, raise your hand. So for those that don't know Madeline, she's our liaison with DCS and brought me forward this. There's 6 topic items here on this list, and I don't know if they're in priority order or not, but the first one on that priority is to look at modernizing the child welfare technology. And then and I'm out of turn here on our agenda item, but I thought since we're on that topic, it's a good time to jump in. So how do we look at these 6 topic items when we can't add anything more to our summer study? So we decided to do it through the Commission to Improve the Status of Children and tying it in with this task force that we serve on here now. And that way, because they're all very, if you look at the items, number 2 is strengthening the prevention and impact to family and resource centers. So those that know that have family resource centers in their community, how unique they are and how great they're doing. And we want to see that spread across our state as much as we can. What does that look like? Number 3 is accomplishing the home for every child ratio. Number 4 is supporting Indiana child welfare workforce, both through DCS and maybe the providers as well. And then improving cross-system collaboration, human trafficking response. And then last is DCS partnership with community-based behavioral health services and outpatient organizations. So we took a motion today. We have a commission to improve the status of children's meeting right before this one at 10 o'clock this morning. So we were already set up here, and the board moved to create these 6 topic items within this task force that we serve on here. So we're going to keep you guys busy, and we truly got to make a difference. And I appreciate DCS, and I know your director Dorfmeyer would be here, but she was at our commission meeting and was excited about this as well. And I know Harmony, if you could just pass on, I believe we are as well as a task force. So I don't want to speak for everybody, but is there any discussion based on what you see here now? And I know it's just been brought to you guys. So if you don't, and you want to study it, look at it, and come back to me with some comments later, that would be fine as well. And then if not, Madeline can answer every question you have. So, any comments?
I think this is a great list. Looking at it, obviously, with number 1, it's going to take money to make sure,
And you're going to provide that?
I'm sorry.
You're going to provide that money?
I'll gladly vote on it in committee when it comes.
We do have a surplus.
Yeah, I'm one of 150, but certainly count on me to be supportive, just because I know that all the work that DCS is doing, and being fairly new to the legislature, money can certainly be an avenue to help address the state of children and child welfare in the state of Indiana. So I'm incredibly supportive of it.
Thank you.
Regarding the data piece, I would point out that the Justice Oversight Committee is working to do the same on the delinquency side, and DCS is represented across that aisle as well. And so I'm really excited to see collaboration and forethought going into this planning, talking about could systems actually talk to one another going forward, as opposed to inputting in everyone and maybe having inconsistencies. And so I'm glad that data is on the top of the list.
And, that's a great point, because just so everyone in here knows, currently when we have a juvenile justice case, and they also have a CHINS, so we have the 3 levels: duly identified, duly adjudicated, and duly involved. And so they can be one or the other. We have no way in our system currently to delineate those children. So when we're asked specifics around populations, how many of your children have both of these? How many this or that? That right now is a hindrance. And so we have been partnering and talking about in the new system, how do we make it where we can easily access that information and break it out to an easier use.
I have a question about number 3, about the 1-to-1 for every child. I don't expect, well, maybe we know data, but do you know what our ratio is today and in comparison to other states?
The ratio today, I don't have it off the top of my head, but it's, I want to say we have like 4 children to 1 home. I think that's about where it is. And so the 1-to-1 effort is our national effort. So we opted into a home for every child, which opened the doors for a lot of opportunities and grants, by the way, which DCS was just awarded. The predictive analytics grant, we were one of 10 jurisdictions nationally that got it. And we're using that actually to use predictive analytics and data to be able to match children to homes based on information versus just who's going to pick up the phone. And so for the 1-to-1 ratio nationally, we're probably right in the middle, some way worse, some a lot better. But we're striving to get more homes and children.
Would that be with siblings too, though? I mean, how would you
Yeah, we place children together in a sibling group always first and foremost when it's both safe and appropriate.
but would that adjust the ratio? I guess is my question.
No,
so if you get
it's
2 or
children.
3
So each children represents themselves. So if you have a sibling group of 4 and you place them in a home that can accept them all, that's still a 1-to-1 because they were each afforded a bed, a space.
Okay, I see.
Mm-hmm.
So these are licensed homes?
Yes.
Okay. I'm trying to understand how Ken impacts this and how you predict how many Ken.
Well, right now our kinship placements are over 50%. So they're not necessarily in that ratio, but so it is a ratio of ready homes.
Gotcha.
Mm-hmm.
Any questions from any other members? Seeing none. Thank you. Thank you for your letting me go out of the agenda course. And so next we're going to go into new business, an explanation of KPIs and scorecards by services line DCS updates.
Oh, wait. There it is.
Every piece of landmark legislation really comes down to a simple choice. We can treat Senate Enrolled Act 5 as an administrative chore to survive, or we can seize it as a genuine historic opportunity to elevate how we protect Indiana's children. We're choosing the opportunity. Good afternoon, everyone, and thank you, members of the task force, for having us here today. It's truly a privilege to stand in front of a room full of people who dedicate their lives to keeping Indiana's children safe. I'm Molly Morgano. I'm the new Director of Procurement at DCS. I'm joined today by Anna and Maggie from our vendor management team. My career is focused on managing public sector operations and governance frameworks, including my time spent navigating high-stakes environment of the Chicago Police Department, Chicago Water Department, Chicago Transit Authority. If there's one thing that these types of public services teaches you, is that goodwill is wonderful, but bulletproof accountability is actually what protects people. I specialize in turning complex public infrastructure into data-driven systems that actually deliver. And that is the exact operational lens I brought to the strategy we're going to look at today. Our goal today is simple and honest. As we implement Senate Enrolled Act 5, we are building an internal framework that is fair, clear, and generally manageable for the partners who count on us. Let me speak to a very real, very valid concern. Whenever the state rolls out something new, providers understandably get anxious. The word is always the same: more paperwork, less time for the families who need you the most. We hear you, we really do, and we get it. That's exactly why this is a true partnership. Yes, DCS built the initial structure to meet our legal obligations, but we refused to build it in a vacuum. So over the last month, we took this framework on the road. We introduced it to the statewide ICFBS meeting on July 9th. We sat down with IARCA home-based service groups just last week. We are actively listening to IARCA providers, because here's the truth. They are the experts on the ground, and together we're going to refine this rollout to make lives easier, not harder. Vendor management isn't a new set of rules. It's a standardized data-driven tool to track contracts transparently. Under SEA 5, contracts over $500,000 need to have clear success metrics. And our job is simple, to give you the tools to meet those metrics calmly and confidently. No new burdens. We're launching this with a smart phase pilot approach. Phase 1 focuses on 3 priority areas: Healthy Families Indiana, intensive foster care, and our community-based contracts. Here's a timeline you can count on. August, group meetings with our DCS contract owners. September, October, framework kickoff and contract amendments. The routine going forward, evaluations every 12 months. I want to be candid with you. We view 2026 as a shared learning year. We will fine-tune this process together because ultimately today isn't about paperwork. Today is about a cultural shift at DCS. For the first time, Indiana is moving away from a check-the-box system and toward one that measures real-time safety and proven outcomes. The bridge that gets us there is the new DCS scorecard. It takes the compliance data already sent to us and organizes it into 3 clear, steady categories. Scorecard does the heavy lifting internally. This is common sense governance. This is not a punitive crisis. Think of it as an early warning dashboard, one that celebrates strengths and lets us step in with support early before small things become big ones. The exemplary performers will be recognized. Your positive track record will stand as an official reference for future grants and projects. This is about celebrating what is working and helping Indiana kids thrive. So here's the heart of it. My ask for everyone in this room and everyone across this state. It's an easy one. Let's build this one together, step by step. Nobody's flipping a switch on overnight. Transparency isn't something we're going to spring on anyone. It's going to be our shared strength, and we're going to earn it the honest way. Right now, our contract owners are already hard at work with those phase 1 priorities, building on measures our providers already value and already are doing well. We're not starting from scratch. We're building on strength. As we move through August, you'll hear from us more, not less, structured program-specific meetings that walk you through what this means, what training will be available, and the scorecard itself. Come September, October, we'll finally launch and finalize those amendments. And looking into 2027 and beyond, we will thoughtfully extend this framework to all DCS contracts over the $500,000 threshold, gradually and naturally, as contracts are renewed or amended under the new law. No shocks, no surprises, just steady, deliberate progress. Change can feel daunting. I understand that. But phased, transparent rollout means you'll always see what's coming. We are fully committed to the time, the training, and the one-on-one conversations it takes to make this transition feel seamless. Thank you, every member of this task force, for your time, your questions, and your steady dedication to Indiana's children. Laws set the standard, but leaders set the culture. Let's build a culture where Indiana's kids don't get by, they thrive. Now let's turn to the slides. Let's pull back the curtain and look at the blueprints together. When a government agency introduces a new data-driven framework, I know exactly what everybody's thinking. You're worried about more red tape, more hours on paperwork, and moving goalposts. I hear you and I get it. But let me be incredibly clear. This is a win for your organizations. Vendor management is not a game of gotcha. It's about creating fair, predictable, and a level playing field. Here's what this actually means for providers and contractors. Protection for providers. Objective data protects you. It removes subjectivity, ensuring hard work is accurately recognized. We want to respect your time. We preserved existing reporting structures. We are not writing routines. We are just organizing the data better. a shared burden. This is a two-way street. Our DCS contract owners will walk this path with providers and contractors to provide clarity and support. We cannot achieve the goals of this law without you. This framework gives the clear metrics providers deserve, proving with hard data the incredible impact providers make for Indiana's children. Let's address the elephant in the room. Why this, why now comes down to two things: our shared mission and a new regulatory reality. First, our mission. We owe it to you. We owe it to the children we serve to have total transparency. This tool is about clarity. Better internal tracking means we can see, celebrate, and support your work. It ensures our data accurately reflects your daily dedication. Second, we're facing a firm legislation deadline. We are officially in the era of Senate Enrolled Act 5. Under this new law, any contract over $500,000 must include explicit success metrics in standard IDOA template. This is how we're going to handle this transition together. When you look at our vendor management objectives, we want you to see exactly where our hearts are. Every single goal here exists to support our North Star, protecting children, supporting families, and ensuring every Hoosier child thrives. We cannot reach that goal without strong relationships with all of you. That is why our objectives focus entirely on mutual success. Here's what we're aiming to achieve together. We want to optimize our partnerships. This is about fixing our internal processes, not micromanaging you. We want working with DCS to be streamlined, predictable, and fair. We want to enhance our transparency. We owe clear communication. We are taking the guesswork out of the equation by clarifying metrics up front. No moving goalposts. You always know where you stand. We want to empower our providers. This is the most important piece. We want to give providers the tools and clear data they need to succeed, because when their organizations thrive, our kids thrive. This framework is built to empower, not restrict. It's about creating a transparent system where work hard can truly shine. What is in this for you? True partnership means framework has to benefit both sides. This is where the rubber meets the road for your organizations. First, this framework is designed to celebrate excellence, earned recognition. When you meet and exceed your KPIs, DCS will formally recognize it. A positive evaluation is a powerful asset. You can use these metrics to prove your real-world impact to your boards, your donors, and the state. Second, it provides a permanent shield of data, a clear, fair record. We are building a historic record of your performance over time. If there is ever a misunderstanding or a leadership change at DCS, you have unassailable track record to protect your reputation. Finally, it brings predictability to your calendar. No more fire drills. We know how exhausting unexpected last-minute requests are. By moving evaluation schedules, intervals, you will know exactly when reports are due well in advance. No surprises and fewer interruptions. This system is built to honor your hard work, protect your history, and give back precious time for the families who need you. So who's impacted and when? I want to be clear. We are not flipping a switch overnight. We know how complex your operations are, which is why DCS is taking a deliberate phased approach. We want to get this right, not fast. For 2026, we are starting with pilot phase 1, an initial pilot focus strictly on contracts over $500,000 within 3 specific areas: Healthy Families Indiana, intensive foster care, and service community-based contracts. In the first group, we look at this as an opportunity to build the road together. We are going to learn, refine, and protect this process alongside our providers and contractors. Looking ahead to 2027 and beyond, we will gradually expand all other DCS contracts over that $500,000 threshold, but we're going to be smart about it. We will base our timing on natural contract cycles, upcoming amendments, and legislative requirements. Here's my promise to everyone in this room: no surprises. Providers will have a seat at the table, plenty of notice, and our full support every step of the way. To make this transition as smooth as possible, DCS is building a vendor management directly on top of existing contracts and current expectations. Here's the breakdown. The existing KPIs. Most of the contracts already have key performance indicators built right into them. They just go by different names today, like performance standards, outcome measures. If you work under our DCS service standards, you already know goals and outcomes section. Those are your metrics. We're just organizing them. Standard contract clauses. This framework relies on the exact same standard contract clause contractors signed up for on day one, like clause 1 for duties, clause 7 for audits, and clause 8 for payments. Here's the big takeaway. Providers and contracts are already doing this work. They're already meeting these standards. Vendor management isn't adding new burdens. It's just consolidating what's already been being done well into a clear, predictable system. We're honoring existing agreements, improving success with clear data. Now let's talk about the actual mechanics of what is changing in the contracts, because total transparency is exactly how we build trust. When it comes to the legal boilerplate, we are keeping this as straightforward as possible. The vendor management framework will be defined using standard predictable language added to new contracts and amendments. This ensures that everyone across every organization is playing by the same exact rules. Here's exactly where you're going to see it. In the contract language, we're adding a brief high-level description of vendor management right into the existing duties of contractor clause when your contract comes up for renewal or amendment. It's clear, it's upfront, and it will include a direct link to official policy once it's formalized. No hidden fine print. In the official policy, to make sure everyone always has access to the rules, procedures shared and piloted with phase 1 vendors, will be formalized in a brand new comprehensive policy document. This means guidelines, processes, and requirements will be fully accessible to teams 24/7. By putting this clearly in writing and hosting in public online, we are eliminating any guesswork. You'll always have a direct, permanent reference point for our processes, ensuring that our partnership remains stable, predictable, and fair from day one. Now, don't let the word policy panic you. This isn't a wave of new rules, but a master blueprint for fairness and clarity. Instead of bearing requirements across a dozen manuals, DCS is publishing a single consolidated playbook to govern the vendor management framework for all contracts. It's your go-to reference guide, laying out exact requirements across 5 key areas: performance data collection, evaluation categories, grading methodology, key performance indicators, KPIs, annual VM evaluation process. By putting everything into one public document, we are eliminating surprises and moving goalposts. It gives us the exact same playbook for success. All right, let's look at the actual architect of these evaluations. Vendor performance will be filtered through 3 straightforward logical categories. This isn't a one-size-fits-all hammer. DCS contract owners will tailor the specific KPIs for each bucket based on unique service standards and funding. Here's the breakdown of the 3 categories. Administrative compliance. This is about keeping the trains running on time. This focuses on foundational terms like invoice accuracy, staff qualifications, timely reporting, and regulatory compliance. Service delivery and outcomes. This is the core of the daily work. This measures the actual quality, timeliness, effectiveness of care, focusing on real-world client outcomes. Communication and collaboration. True partnership. This tracks responsiveness, swift issue resolution, meeting participation, and active engagement with DCS staff. There are no tricks here. This is a balanced scorecard that honors providers' administrative discipline, providers' clinical excellence, and our communication as partners. I know everyone's immediate question is what will these KPIs actually look like? My best advice is to look at what providers are already doing. Review the current contract requirements and DCS standards. They are the blueprint for future metrics. As we roll this out, keep two things in mind. Consistency is key. DCS will standardize KPIs across contracts within the same program area. Providers doing the same critical work will be evaluated on the same fair scale. The final arbiter, to maintain a level playing field, DCS is the final say on which KPIs are included. But remember, this is built entirely on existing expectations. We want everyone prepared and confident, so we are making the playbook completely public with two straightforward resources. IDOA Public Contracts Search Portal. Search for any active agreement by your business name. DCS Service Standards Portal. Access complete updated standards online 24/7. Now, let's look at the math, because transparency in grading is just as vital as transparency in metrics. To ensure complete fairness, your performance will be evaluated on a predictable, standardized 100-point scale. There's no mystery here. Everything adds up to a clean 100, and here's the breakdown. Predetermined weights. Those 100 points are distributed across 3 categories as we discussed. DCS establishes these weights well in advance, so you will know exactly what each section is worth before the clock even starts. Earned points. Providers' performance on specific KPIs determine how many allocated points you receive. Simple total. The final score of the straightforward sum of all points earned across 3 categories. By laying out the math up front, we are removing subjectivity. Providers, contractors have a clear objective roadmap to track their own success. Now let's look at how the scores translate into overall performance tier. Transparency is key here, so everyone knows exactly where they stand. Your total points place you in one of 4 clear categories: exemplary, 80 to 100. Celebrating your success. These scores let you officially demonstrate clinical and operational excellence to stakeholders across Indiana. Satisfactory, 62 to 80 points. Meeting core benchmarks, delivering reliable service, and successfully fulfilling your contract. Needs improvement, 45, 62 points. Unsatisfactory, 45 points. This is an early warning system showing something isn't working. It may trigger a corrective action or a performance improvement plan. I want to pause and emphasize the heart of this framework. A needs improvement score is only a prompt for collaboration, not a final verdict. Our ultimate goal is to help providers succeed because kids depend on it. This metrics lets us look at the hard data together and pinpoint exactly where we can course correct. While DCS manages contract compliance daily, this annual scorecard ensures a fair, structured, and predictable way to keep our partnerships healthy and moving in the right direction. What we're doing here makes Indiana a pioneer. This framework is a historic first for our state and a true game changer for how we support vulnerable children and families. Because this is so vital, we want to be completely transparent. Every single KPI will be graded on a straightforward object 0 to 3 scale. Score 3 is excellent, consistent, top performer that meets or exceeds expectations. Score 2, satisfactory, solid, reliable work with only minor isolated deficiencies. Score 1 needs improvement, an early warning showing frequent deficiencies starting to impact service. Score 0, unsatisfactory, severe or prolonged deficiencies causing serious operational hurdles. Our DCS contract owners will use this exact metrics to generate your total VM score. Please hear me on this because this is the most critical takeaway today. We want providers to succeed. This scale is a tool. This scale isn't a tool to catch you failing. It's a diagnostic thermometer designed to show where providers are thriving and where we can step in to support them. We are in this together and we're going to get it right together. Now let's talk about how scoring actually works, because transparency in here is absolutely key. As you can see on the screen, we have a clear structured scorecard template. It breaks down into 3 distinct performance categories: administrative compliance, service delivery and outcomes, and communication and collaboration. I want to emphasize the timeline here to get everyone a peace of mind. No one is going to be graded on a moving target. Before any evaluation period even begins, your DCS contract owner will completely fill out this template with the identified KPIs tailored specifically for your contract type and program area, alongside the predetermined points assigned. You will know exactly what the test looks like before you even have to take it. The process is straightforward. We look at the concrete data, apply the scoring guidelines, and calculate the earned points. This removes the guesswork and ensures a fair, objective summary for every single vendor. It is all about setting providers and contractors up for success by being clear, upfront, and consistent from day one. Let's look at the concrete example of how this plays out in practice. What you see on the screen is a mock-up with sample KPIs, but it shows just how balanced and achievable this system is designed to be. Look how the weights are distributed across the 100-point total to see our true priorities. Service delivery and outcomes, 50 points. This is the largest piece of the pie. We focus on meaningful metrics like child outcomes rather than burying you in administrative paperwork. Administrative compliance, 30 points. Covers essentials like timely background checks and accurate reports, which are critical for safety and accountability. Communication and collaboration, 20 points. Measures teamwork, meeting participation, and satisfaction surveys, because our relationship with our providers and contractors matter. This framework is not a gotcha system. It's a fair, transparent roadmap that recognizes hard work where it matters most, aligning our goals so we can protect Indiana's children together. Now let's take a look at the formula we just discussed and look at what it looks like when we put it all together in a final summary. On this slide, you will see a completely filled out example. This shows exactly how those individual scores flow into the category totals and ultimately into the final number at the bottom. Let's walk through it together. Under the first category, the 2 scores 0 and 1 add up to 5 points out of 30. In the middle section, our critical services delivery area, the reviewer gave the straight 2s across the board. The math converts to 11.33, 11.33, and 10.67, bringing the category total to exactly 33.33 points out of 50. Down in communication, a 2 and a 3 combined to bring in 16.67 points out of 20. When the system pulls all these pieces together, it delivers a final transparent total vendor management score. In this specific mock scenario, that comes out to 55 out of 100. The reason why we want to show you this complete picture is to demonstrate nothing is happening in a black box. You can trace every single decimal point directly back to a specific KPI. It gives both DCS and our partners a clear, shared line of sight into exactly where things are going wonderfully and exactly where we can collaborate to move the needle. Now, this brings us to the core of how we ensure fairness, consistency, and documentation. I know a common worry with many new evaluation frameworks is subjectivity, the fear that a score depends entirely on who happens to be reviewing your file that day. We want to take that worry completely off the table. As you look at this slide, you will see exactly how DCS Reviewer justifies a score. We're tying every single number to a clear written equitable scoring guidelines alongside a dedicated section for reviewer notes and supporting documentation. Let's look at how this plays out across these examples. For score 0, this isn't a vague feeling. The guideline explicitly requires demonstration of severe or prolonged deficiencies. The reviewer's notes must back up with concrete data, like pointing to specific monthly reports where outcomes fell significantly below our thresholds or noting an active correction plan. On the flip side, a score of 3 means a contractor has consistently met and exceeded our expectations. The reviewer notes exactly how this was achieved, referencing concrete data like hitting a 95% threshold month after month. A score of 1 represents a notable or frequent deficiencies that impacted service delivery. And again, the reviewer must document the exact timeline and impact, such as a specific delay in month 4. We want you to see this because it demonstrates our commitment to a transparent partnership. Our reviewers just aren't clicking a drop-down menu and moving on. They are required to show their work, provide the context, and gather the facts, and ensures that every conversation we have about performance is rooted in data, mutual understanding, and clear paths forward. Let's talk about the actual rhythm of this evaluation process because predictability is essential for a healthy partnership. The framework relies on 3 main pillars. Flexible timing. We know a one-size-fits-all timeline doesn't work. While evaluation intervals will be tailored to specific program needs, every contract will be evaluated at a minimum of once a year. Clear communication. You will never be left guessing where you stand. At the end of the evaluation, your DCS contract owner will provide a comprehensive written report detailing your scores, findings, and any support corrective action to help get things back on track. Consistent compliance. This new framework operates alongside our traditional oversight. It does not replace existing contract mechanisms used to ensure compliance and protect program integrity. Ultimately, this process formalizes our communication. It ensures that data, expectations, and feedback are delivered clearly, predictably, so we can work together effectively under the new law. The implementation of Senate Enrolled Act 5 is not a bureaucratic exercise to survive. It's a historic opportunity to elevate how we protect Indiana's children through a disciplined phased pilot rollout that prioritizes contract support and total transparency. We are incredibly grateful for IARCA and our other dedicated stakeholders for their exceptional partnership. DCS is leveraging current agreements and focusing squarely on meaningful KPI accountability because tracking these outcomes is in the absolute best interest of the families we serve. Most importantly, we are executing this hand in hand with key stakeholders to ensure our strategy matches operational reality, protects frontline caseworkers by limiting redundant data entry, and establishes a fair, no surprises model featuring pre-finalization review periods. To wrap things up today, I want to leave this task force with a clear, reliable roadmap of how we are moving forward together. As we established in the beginning of our presentation, implementing Senate Enrolled Act 5 is not an administrative chore to survive. It's a historic opportunity to elevate how we protect Indiana's children. Our biggest ask for everyone in this room and across the state is simple. Let's build this bridge together step by step so that total transparency becomes our greatest shared asset. Again, no one is pulling an administrative lever overnight. This is a deliberate, thoughtful, and phased approach. Right now, our DCS contract owners are already hard at work on our Phase 1 priority contracts, specifically targeting Healthy Families Indiana, intensive foster care, and community-based contracts. They are identifying program-specific measures that align perfectly with existing provider priorities and requirements. We are grounding this entire framework in what our partners are already doing well. As we move through August, communication is wrapping up significantly. We are hosting structured group meetings with our contract owners to provide detailed program-specific information. We will walk providers through exactly what this means, lay out the training opportunities, and outline the new DCS scorecard. We are ensuring they have all the tools they need to achieve these targets with full agency report in a streamlined, manageable process. Looking ahead to September and October, we will officially kick off the framework and finalizing those contract amendments. I want to emphasize to the task force again, we view 2026 as a learning year. Evaluations will occur every 12 months, and we will use this upcoming window to fine-tune this routine together. Finally, as we look to 2027 and beyond, we will thoughtfully expand this data-driven framework across all DCS contracts valued over $500,000. This will happen gradually and naturally as contracts are pre-procured, amended under the new law. We know transitions require deliberate management. That is why we're investing heavily in the one-on-one conversations and training needed to make this seamless. Thank you members of this task force, for your time today, for your incredible partnership and your unwavering dedication to Indiana's children. We have the right plan. We have the right team. And now it's time to deliver. Let's get to work. With that, I want to respect your time, but I'm also very eager to hear your thoughts. And the team and I are happy to take any questions or feedback you have for us. Floor is yours.
Thank you, Molly. Do you need a glass of water? You
I do.
did a lot of talking
I do.
there.
Fine.
Thank you for your presentation. Does DCS have a plan to review service standards to ensure that they are appropriate for this matrix, as well as make sure that everything in service standards we actually have control over?
Yes, we're reviewing everything.
Thank you so much. That was a lot of work, I know, and a very short period of time. And I have always been concerned about, where does our taxpayer money go? And how are we spending it? And are we getting what we need to? Also, we're a large foster care provider. And I know I'm so very thankful that you've included us. I know my staff have been involved in many of the IARCA conversation so far. And, we're a large agency. We collect a lot of data on quality right now. And it's very important. We review it every quarter. And, I always tell my staff the quantitative information, the actual numbers, get us to the qualitative. Every single child is one of those numbers that we serve. And that's always a concern for us. And I can tell you, as many of you know, the seas of change, what's happening and affecting our children and our families. It could be next week we're going to see another issue that our families are dealing with that we didn't expect, didn't see coming, et cetera. And we know by reviewing every quarter, we have seen, I can just tell you, we were having disruptions more than usual. And then we're hearing stories about a little 8-year-old who was having panic attacks in the middle of the night, and our staff, our case managers, were going out and helping that foster family console that small child. And we saw that our data, our outcomes were slipping, and so we were able to assess it, to say, okay, what's the situation here? And it was very difficult time getting access to behavioral health services for our little people. And so we were able to get a grant, and we were able to build an internal behavioral health program that can be accessed by our children, and that little 8-year-old had access to that. So I think, again, this is all moving in the right direction. We're so very happy, but I am concerned about thinking about those individual children and how an outcome that may look bad in the numbers is actually an opportunity for us to figure out how to better serve our children. And I think about that report card, and I think about I just came across my report cards when I was little, and I had, A, B, C, and had little number, little S, and then also she talks too much, and she, super friendly. Maybe we're going to have to, so if you look at the, my little S or my little S minus, the story was in what was happening in that qualitative piece. And my concern is that we just have to hold on to that. When, again, we're a large statewide provider, things look different all across the state, and just making sure that we're not losing these children in these numbers. And, but that also, we're getting, and we can all, probably all of us here have at one time or another thought, wow, that agency got that contract? Oh, yikes. And so having some kind of a performance measure is so very important, because we all care deeply about those children, but it is about the children.
Exactly. Thank you.
So I don't know if I had a question, but that just a concern.
Statement.
Well, I think my follow-up on what Shannon was saying is, would you then, what you didn't address is, there would be scores, tied to your vendor management or your organization. Would those then be figured into the scoring rubrics on contracts? Because right now the scoring rubrics weigh most heavily on how inexpensive are you. And so, it would be good if the qualitative piece was there because we all have seen contracts go to folks that we know don't have any expertise in those areas because they underbid the contracts from a cost perspective.
Yeah, no, we're looking at everything, and I thank you so much for your question. We have a list of questions that we're keeping a tally on, and I can share that with everybody. After we met with IARC, after we've met with ICFBS, we have just a growing list of questions and concerns, and we can share that with this entire team as well. But are you worried that our scoring is going to go into a contract like a?
No, I want to see it go into the scoring rubrics.
You mean like
being awarded.
Yeah, we can definitely look into it.
Yeah. Because what happens now is it's whoever's cheapest, whether you know. I mean, because the way they're weighted, whether you know anything about the service or not, if you underbid it, a lot of times because you don't know what actually goes into delivering the service, then you get awarded a service.
Right.
And that's not just a DCS issue. I mean, it happens in the way the state scores contracts for lots of things.
Yeah.
But we've seen some just really
there's some awful
difficult things happen because of that bent towards scoring. So as a vendor, I would like to see my quality scores measured into my performance on a contract bid.
Well, one of the hopes to doing this scorecard, and if you're a high performer, like this is your scorecard and you can take this, and we're hoping this is going to expand, right? I'm hearing rumors all over the place from different cities, different states, different organizations. People are using vendor management. I just talked to a contractor yesterday. They're actually using vendor management inside their own organization because they're a QPA. So they have all different kinds of contractors and stuff. I'm like, I'm interested in seeing that. Right. But our hope is that this scorecard, and you're a high performer, gives you a leg up when you're going and getting a project, a grant, anything. Like this is going to spread. This is good stuff. I don't see why it can't, but I mean, we're just in the very beginning of it.
Will these scorecards be publicly available?
We're kind of going back and forth on that right now, just to be honest with you. I do know that every contractor, provider, whatever, is going to have a full list of what their score is, how we got to that determination. We're always open for dialogue.
But DCS doesn't have plans to publicly.
Not at the moment. Right now, no.
Will vendors be held accountable when they're unsatisfactory? Will you end contracts? Or
yes. So we are tying in our policy. We are tying. So if they get a poor score or whatever, they're in the policy. There is they have like a 60-day discussion with us, and then if we can try and rectify it. I mean, part of the goal here is, to help providers, to make them succeed, to give them the tools to be successful. So if somebody is really just not performing at all, I mean, we will go them back to the contract itself and pull up, what the disciplinary action will be. I mean, up to termination.
Yeah.
But we have to follow the contract rules on this. So.
And then I think I'd be remiss if I didn't mention that. So for me, background checks ties directly to child safety.
Yeah.
And that's a low score for me.
Okay.
Like you only weighted that 15 points. So I think child safety is the number one priority of the department, right? And so
I know. And I can
that
totally take that in consideration. I'm going to bring it back to the team. I mean, nothing's set in stone right now, but absolutely. I mean, we have the same feeling. Background checks are huge. It's a huge safety concern.
It is. I know it's also a big lift for our providers in terms of compliance, and it's challenging, right? So I get that there's
expensive.
A balance to that, but it's
understood.
important.
Thank you.
Thank you for your presentation. Appreciate it. Is there opportunities for vendors to appeal?
Mm-hmm.
Okay.
Yeah, that'll be in the policy. We have the draft on. It's going through our internal process for approvals. So once that finalized, like we said, we want to make everything transparent. We want it up online, want everyone to be able to see what the process is. If you have to dispute something, what that looks like and what that process is, that'll all be available online, and anybody can look at that.
Okay. And then my second question is that if we have a vendor who continually is having poor performance,
Yeah.
can they then continue to bid, or is there a cooling off period for that vendor where they need to get it together before they could reapply?
Right. We're gonna have to work with IDOA on that and what that's gonna look like, but that is definitely on the table for sure.
Thank you.
I really appreciate all the thoughtful work you put into this, and just echo the comments about using the quantitative data. I wonder in these kind of evaluation processes, and as I think about disaster responses that some of our peers are pivoting to as nonprofits now in the state, perhaps it's in the comments, but mitigating factors and pre-appeal to say, we had flooding in 3 of
Yeah.
our facilities and we had to put sandbags out. Just thinking about some context, anything that a vendor might note what happened in the year or quarter, not in a defensive way, but just to give, as we look at data, like
Yeah.
what is causing these
We're
trends?
gonna have constant contact with our vendors, and like, we're already reviewing and we're monitoring in that. We're just consolidating what's already been given to us and making it into a legible, readable dashboard where we're gonna be able to see what's failing, where we can step in. And if somebody's failing and, there's some really, really challenges with this, then we can take it to another level on a contract side with IDOA.
Under the service delivery and outcomes category, I'm wondering if evidence-based practices can be weighted in that area, because that's considerable investment from the provider community. And I think it goes to quality, and it goes to sometimes the market gets saturated with vendors that don't make that investment.
Okay.
To Tina's point. And I think when we're looking at true outcomes, we probably should also use the practices that are connected to research.
Correct.
So if it can be weighted in the performance area, it will give some credit to the organizations that have made that investment.
Okay, we can definitely put that in with our notes and look into it. What we're doing is just to clarify, we're taking already existing reporting, which would be background checks. They're invoicing, different kinds of things. So we'll take that into.
Some of the evidence-based practices
Yeah.
are in your service standards.
Yes.
And the usage of those is varying. Is what she's getting at. We're not
Right.
asking you to hold us less accountable as a field. We're asking you to hold our field more accountable so that kids get better outcomes, and the state's investment in the system is a better investment. Like, I think many of us have been encouraging
Right.
more accountability for some time. So we like this. It's just that's what she's getting at. Some of those things are in service standards, but I would say how people subscribe to them or don't is not consistent.
Right. Sometimes
Understood.
what happens in practice at this point that I'm objecting to is examples like we provide family preservation services. And so we have the whole continuum of services. So if a family comes to us, they can receive substance use services from us and behavioral health services or community-based services. But sometimes DCS will allow another agency to take that family that cannot provide the primary treatment area, like substance use. And then that agency will try to contract with us, subcontract with us to provide that service. When the intent of the services is that continuity of care, one agency providing all the things that family needs.
Okay.
And so there is a lot of carve-outs right now that really reduce the quality of care that a family would receive.
Okay.
And sometimes the market is saturated with people who do not have the qualifications to provide the quality. But I know this is not totally a DCS problem in the sense that DCS currently doesn't have a way to prevent those individuals from contracting.
Okay.
But it seems to be a problem with consistency,
Understood. Well, when we get with our contractors and our providers, I hope that you're present so we can go through what the KPIs are where we got these, what does it look like moving forward? We welcome your questions. We welcome your concerns. I want people to keep asking questions because we want to get this right. You know, and so like you have different experiences from this one, or we want to know because we're not gonna be able to take care of everything, but we want to do the very best that we can to make it right.
If I have a question, more so a comment, if I'm hearing what I'm hearing correctly, is that some of the larger, robust agencies feel a little bit more restricted than a smaller agency who can't provide as much. With that, am I understanding that
I think
correctly?
sometimes what happens is FCM, what maybe not all the experience in the world, will make referrals to people that they're just comfortable with. They establish a relationship with them. That may not be the best match or service for that family. It may not be the agency that actually has the whole continuum of care that is needed in that case. It just may be someone that they've established a rapport with. And when we question that, they'll say, oh, they can't help that. They don't have those services. But they still leave the family with them. And that agency will then come to us and say, can you provide this service?
And then they want you to bill Medicaid
When they
for
want
it.
us
And
to
then
bill
they keep the
Medicaid,
money.
and they keep the per diem from
funding.
DCS.
Got it.
So
That's-
her agency's small, mine's bigger. It's the same issue. It's
Right.
not about the size of your organization. It's about some of the agencies that are getting referrals for services they don't offer, accepting the referral, keeping the money, and then trying to get her agencies like hers or mine to bill Medicaid
Which
for
then
the
would
piece of what
cause,
they can't do.
okay,
which
which,
Texas taxpayers.
yeah, I was gonna say, which then leads to
And-
one, billing a system that's already,
It's
okay.
this hole in the system right now that I'm wanting to make sure gets addressed.
And I mean,
It
with-
defeats the purpose of the service because it's supposed to be you come to one place and get all your service.
and I guess I'm the freshman, so I'm gonna look at my, yeah, please.
So I guess kind of a question. So will DCS, so beyond SCA 5, right? Like that's maybe the impetus for doing this. But beyond that, is this data that DCS wants to use to properly train their FCMs to choose the right vendors maybe? I mean, like, is this going to be used beyond just some compliance, right? Like I've worked on lots of child welfare legislation. So lots of people call me, talk to me. Specifically, I talk to foster parents who are taking their kids to 10 services a week, right? Like, is that effective? Is that the best use of resources? Or is that just kind of naivete on the part of the case managers or the judiciary, who's ever ordering those services? Too much duplication, not the right child. So is all this going to be used together?
Yes.
Okay.
Like
the
and I
long
think,
term
I think
part
we're
of it.
actually going to talk about utilization management, but a big focus is really lifting up the skill set of our frontline to be able to understand the family well enough to get the correct. It's a bit of a gap now. We used to be really strong at it. We have probably waned in that way. So as we lift up what are our KPIs, what are we looking at? We're matching that with the frontline, understanding that as well. We have a services hub app that we're expanding right now as well to try and match all of this together.
And so kind of off of what Janine was saying too, also trying to make sure we are using the providers the all-in-one providers when possible.
Yeah, continuity of care is huge. And I think we're just missing that concept.
So you don't know necessarily that you have licenses with the vendors that do or do not have all the capabilities that maybe they say they are if they're trying to subcontract. Is that fair to say?
I think that's what we're going to be looking at. And actually Nathan might touch on that. If not, we can look at that. But that is in the scope of looking at and being able so that the app is supposed to also make it very clear what is a provider can or cannot provide.
Hopefully too, that will help you like identify gaps across the state, right?
Yes.
Assuming in
Service
some of your
gaps,
service
exactly.
gaps in some
So
of your rural
I know they're
communities.
trying to work on even a heat map.
Yeah.
Like, so if I
Yeah.
need this service and I'm in this county, do I have a desert of service or do I have the opportunity?
Right.
Mm.
That'll be good.
Yeah.
Yeah.
Yeah, absolutely. Is the market too saturated here? Yeah.
Harmony, how many vendors or contractors or providers do we have in the state roughly, do you know, that you work with?
600. Yeah, well,
600?
for community based,
That's our whole portfolio.
Yeah, it's 500 to
DCS.
600. Yeah.
Yeah.
Are you gonna have one big party to explain all this to them, or are you gonna try to do it?
We're gonna provide your catering, right? No. I mean, I that's a fair question. Is what the rollout communication? plan
Yeah,
might be.
we're going to be meeting with, like right now, we're starting with our pilot program. It's going to be those 3. So we're going to be meeting with the contractors for each one of those groups. We're going to, like I said, we're going to show you what the scorecard looks like. We're going to show you what the expectations are. We welcome your questions, your concerns, and that's how we're going to do it. And then moving forward, we're just going to do groups at a time. Yeah.
Gosh, I didn't even know there were that many providers, and I'm going to put on my taxpayer hat now. And is that going to cost this rolling out this mechanism going to cost the state and DCS more money to? That's a lot. A whole lot. So every one of those contractors are going to have this made. They're going to have this. No, under 500.
Oh no! Every contract that's over 500.
Over 500. So how many are over 500? Okay, so about half will get this, and half will not.
Maybe a little bit more. Yeah.
Okay.
400 total.
Is there a plan? I probably should have paid more attention, but is there a plan for those smaller agencies? That's kind of the next round to be able to monitor their.
Yeah, eventually we want to do it to all of them, but right now, I mean, this is totally new. I think we're the only ones in the state government that's doing a vendor performance report card, scorecard, if you will. So we're doing this as a pilot program. We're gonna test it, see what works, what doesn't work. We appreciate everybody's feedback. We encourage it. So again, we just want to make it right.
Okay, so cost neutral to DCS.
Yes.
Harmony started off talking about technology and the need and the ask.
I knew that was.
Do we? I mean,
no.
Is DCS? Do they have the technology to go ahead and roll this out and implement it?
Yeah.
Get off is no
We
problem.
did already
with that.
contract this.
Yeah.
Great. But what we still need, we still need the request, right, for next year.
Well, I guess that's a good question. I think we already covered this in our last budget. So I hope I'm not misspeaking. I'm serious.
In the budget.
Yes.
All right, Molly, last question. You said you came from Chicago. Cubs or Sox?
Oh.
Well, I have to be honest. I'm Southside Irish, so Sox. But I married a Cubs fan. Does it? We watched the Classic last night. And my daughter was actually on TV. She was behind the home plate. So like everybody was, it was like the worst picture ever. Like they must have been really bad. I don't know what happened, but yeah.
Well, thank you.
Thank you.
All right, next and last, because we're going to move forward. The explanation of licensing, and we're going to do that next time. And so we're going to move forward with the presentation on service utilization. We have a manual. We still doing it.
Okay, sounds good. Hello, everybody. My name is Nathan Johnson. I'm a division director with the Department of Child Services. Thank you all for the work that each of you do on the task force, and thank you for having me here. As was shared, I'm going to be talking to you all about service utilization. So we can go ahead and go to the next slide. All right, so first off, what is utilization about? So ultimately, it's about ensuring services that we as an agency are providing are aligned with case participant needs and are being given at the right intensity. You know, ultimately, if services are aligned to needs, case outcomes are going to improve and our spending is going to be optimized. So to inform this, we have been doing case reviews of 2+-year-old cases. We have conducted reviews in Madison County, as well as 2 of the Marion County offices. And we're going to review all the 2+-year-old cases in the other 2 remaining Marion County offices. These offices were chosen due to the high spend that was occurring in those counties. One thing I'll call out too, we're doing a regular pull of our data. So as new 2+-year-old cases kind of flip over to 2 years old in those counties, we're grabbing those as well. So based off these reviews, we are providing case-specific recommendation and action items for that office. So those could include things such as discontinuing a service, reducing the intensity, possibly consolidating providers, or even continue as is. These reviews are done in partnership with that local office, with regular touch points between the utilization team and the office, as well as us tracking that the recommendation and action items are actually getting done and being completed. While the focus is on services being aligned with needs while doing these reviews, we will provide feedback on other case-related items. So even though our scope is specific to this, ultimately, if we see something, we're going to say something to them. Additionally, based on kind of the bulk of reviews, we do provide themes based on those for the local leadership to pursue potential process improvements or education opportunities for their staff. Next slide. So what have we been seeing in the reviews to this point? So let's start with some strengths. So first, case reviews showed parents provided ample services and opportunity to engage in those services. So we saw cases having an array of services provided, referrals available for parents to engage in those to aid in the rehabilitation and hopefully a successful case closure. Second, of the cases reviewed, many services across the cases were recommended to stay in place. So it wasn't a case of, oh, we're just shutting tons of services down left and right. That's really not what was happening. We would see services did address an identified need of a case participant, whether it was a child, parent, resource parent. Also, I thought it was good. We were seeing where resource parents were identifying a service need or had a request, and then we were actively looking to get that met. So I thought that was really good. Third, I also wanted to highlight the local offices' willingness to engage in this process. It's not always super fun to have your work reviewed by others, but they had the eagerness and willingness to learn and improve. Quality engagement through the full process, as well as in follow-ups on ensuring that those action items were completed. Slide. So when looking at the opportunities, some of the main things that we've seen is while the previous slide did note ample services provided to parents as part of the case, we saw persistent non-engagement by parents as it relates to actually doing the services. So this ultimately resulted in a lot of just open referrals hanging out there that weren't being used at all, which obviously is going to delay case progression. So as an agency, I'll call out, we are working on this with an emphasis on instilling and bolstering motivational interviewing skills amongst our workforce. Also, we have new statute that went into effect this year that really kind of guides us on when it's time to kind of transition away from still pursuing reunification services. Second was opportunities within supervised visitation. So within this, saw a few different things. So one was an overutilization of enhanced supervised parenting time. So from our review, it didn't appear that higher level was really needed. So often we were recommending, hey, let's move this down to the standard level. Also, opportunities to potentially tap into the child and family team. So whether that be relatives or informal supports to see about if they could have handled that need for supervised parenting time. We also saw instances of using paid supervised visitation on virtual visits. So kind of on the cases that I'm recalling, the parents in question lived out of state and we were doing a paid provider, but nothing was really noted within the case as to why we needed to do that. So again, was there an opportunity to tap into the resource parent or kinship parent to meet that need if we felt like that it needed to be monitored in some way? We also saw paid supervision on sibling visits when there wasn't any noted safety concerns regarding the siblings spending time together. So again, I can recall one where the siblings were placed in different homes. So again, just was there an opportunity to plan with those resource parents and maybe work something out to where the kids could still spend time with each other without necessarily defaulting to a paid provider. Third was in relation to documented service goals and reevaluating needs over time. So many referrals that we were making, if I was the provider, it wasn't super clear to what exactly it was DCS was asking to happen through that service. So essentially, an opportunity to utilize, SMART goals, specific, measurable, attainable, relevant, and time sensitive, being more concrete and sharing what were the reasons for our involvement. So it was crystal clear to that provider why we got involved with this family. We would see things with vague referral goals, such as, hey, provide home-based casework, continue services. So just an opportunity to really bolster that. And also at times would see a lack of documentation as to why certain services were needed. So for example, there may be home-based therapy being provided to a case participant, but it really wasn't documented as to what were we looking to achieve through that. What were we hitting on? We couldn't see any diagnoses documented within the case file as well. So that's not saying that the service wasn't needed. It just wasn't clear as to why or what it was we were looking to do. Also, this kind of ties back into supervised visitation. So with the reevaluating of needs over time. So with the supervised visitation, perhaps that enhanced level was necessary at start, but as things progressed, with no noted issues or concerns, an opportunity to scale it down to the standard level. We also saw examples of tutoring services being provided where when we were looking at the case, it was showing that the child was academically excelling, on the honor roll, doing really well. So again, it appeared the service was successful, it closed that gap. Do we still need it today? Lastly, also saw with cases near the end. So for example, we saw ones where adoption consents were signed by the parents, and then the case still remaining open for a period of time afterwards. And so with that, we even saw some where we were still doing paid services. Specifically, we were doing paid supervised parenting time with the parents. So really just an opportunity, if the plan is for the bio parents to maintain a relationship with their kids post-adoption, let's start planning and implementing what that's going to look like now versus continuing to rely on the paid provider, which would cease at case closure. Last opportunity I'll highlight is utilizing services for logistical support. So we saw this primarily with home-based casework as well as mentoring. So mentoring, I'll call out, is a service that we can utilize sometimes, typically in the more populous counties. So like in Madison, we didn't really see mentoring come up at all. So with these, saw some of the same items highlighted before, unclear goals. What is it exactly we're looking to use with this service? But when reviewing provider reports, it appeared that we were performing tasks that could have been provided by a resource parent or other informal support. So this involved, just like transportation, appointment reminders. Specific to mentoring, we were seeing, children taken to extracurricular activities, such as like a sports program, where the provider would remain there while the child engaged in whatever that sports program was. I can recall one specifically where it was a boxing class. And then once it was over, would take the child back home. And that seemed to be the extent of what was being provided. We also saw taking children to extracurricular or recreational activities, like Sky Zone, Chuck E. Cheese, or going out to eat. And, the documentation was sharing how they worked on dining etiquette. Mixed in this, we also saw where providers were potentially effectively providing childcare. So we would see that the provider would be with the child for 7.5 hours, across consecutive days for a block of time. So again, just opportunities to potentially to have these needs met through a resource parent or other support. So again, those recreational activities are great. Kids should get an opportunity to do those, but it should be through a paid service where they're getting that met. Also, one thing that we've been sharing kind of with Marion County specifically is there opportunities to utilize cheaper or free alternatives that also would boost childhood normalcy. So think Big Brothers, Big Sisters, or programs like that, tapping into sports programs, children's clubs, or even church youth groups. And what's great about those is that those can remain with the child forever. After the case is closed, they can still go to that church youth group, still be involved with some of those programs in comparison to a DCS paid provider. Next slide. So future, as I highlighted in the opportunities, there was improvement to be had with some of the initial referrals. So what we're looking at now is to enhance the quality, appropriateness, and effectiveness of service referrals. We are looking at having the utilization team to serve as the final approver of service referrals. So we are looking at starting that in Marion County in the offices there. We see this future process enhancement, kind of strengthening the alignment between service selection, participant needs, and ultimately smart goal-driven casework. We are still working through the technology mechanisms. We actually had our first meeting on this a couple of days ago. We think we're going to be able to get something within our system of record where we do referrals, known as Kid Tracks. But we also have a workaround we think we'll be able to tap into until that's actually built out. So in the ideal state, the current thought is that the family case manager will still do that initial referral while their direct supervisor will do that initial review to move it forward. At that point, the utilization team will complete that final review or approval step, which they would, of course, either, hey, we're going to approve the referral or we're going to send it back. And so when returning for revisions or improvement, we see this as a really important part of the process, is that we'll engage directly with that FCM and or supervisor to provide coaching, guidance, and clarification. So again, it's going to include a lot of the stuff we've been talking about. Hey, how do we integrate SMART goals into the referral? How can we strengthen the description of the participant needs, why we became involved, or even worker safety concerns. So that's an important part as well. We don't want our providers going into a situation without being fully informed about where they may be going. It could also include recommending more appropriate service types when necessary. So, hey, maybe this referral was great, but what you're describing is better suited for this service over here. Ultimately, we do expect to see improvement in the overall quality and appropriateness of referrals. We'll be ensuring selections are more accurately matched the family and child needs, give us a better allocation of our service spending, particularly in the high spending counties. And ultimately as well, give service providers clear, more actionable information so they can begin services effectively. We really owe it to the kids and families that we're working with to try to hit the ground running as much as possible. Ultimately, again, through this, we anticipate that outcomes for children and families will get better. I mean, that's really what it boils down to, simply. That's the end of my official slides. Thank you all again. Any questions, comments, concerns?
Are you looking at training for the FCMs or?
So here's what I'll share kind of with some of the themes that we've provided. It would be with local offices, opportunities definitely for education in relation to services. So I know one, I kind of hit on it, I'm not to be a broken record, with supervised visitation. Like, hey, when is it appropriate to go to maybe some of the more enhanced standards versus going the basic? I know Harmony hit it as well, kind of with the services hub. As I've driven more into the service world, as an FCM, there's opportunities to help them when they're selecting services from what we have today, where kind of within our system, not to go too deep into it, it just could be better as far as guiding them in what to select.
Of course, I have a question. Nathan, fantastic job. In the reviews that you guys did you crosswalk with court orders? Not to be offensive to but sometimes.
No, we did. We made sure everybody had access to Wes.
Yeah, I'm just curious if that drove some of the overutilization.
There was. So in Marion County, it was often referenced that the courts had ordered a mentoring service. Now we did dive in though. Sometimes we did find the court orders. Sometimes we didn't. We kind of changed our process a little bit to kind of how we're doing the reviews to maybe help us find those a little bit quicker, because we're spending lots of time. Go, it's not here, it's not here, it's not here. But that was there, and that was kind of one of the themes we talked about with Marion County. Like, oh, is there opportunities to engage with the court perhaps in a different way, to get a clearer understanding with the court of, what are you looking to see happen with this mentoring service, or can, as I discussed here today, to pivot away from like a paid mentorship to some of the other free programs that are out there.
Just to add to that too, because of what we found, Jennifer has actually been meeting with a couple of the judges already about it that are kind of the frequent flyers of those. And we are producing kind of a blueprint of here's the services, here's what it actually is and the cost to those judges. And then on the back end, we have a work group that's actually going to modify our predispositional reports so that it's not just the opportunity for our staff to just cookie cutter, go ahead and refer this no matter what.
Yeah, and I'll add too with mentoring, and sorry if you guys have talked about this before, we again, sometimes mentoring was referred under home-based casework, and so we really wanted to tighten that up. So we modified our process with that as far as it has to go through what we call a request for an exception or RFE to kind of streamline that. Like, this is the method that we should be going through if we are ordered to provide a mentoring service. Yes.
So first, Sarah, I'm not offended by your question in the least, because I think for years the system has driven everything with these cookie cutter orders. So standardized forms are quick and easy to do, and they always include all 10 services for every family. And so I think judges have been talking about this for the last several years. DCS has been talking about it, but I think we need to do better in that area and define things. And I think judges in particular can talk with families about what this means from the bench, because I think families may hear it from the bench. The other piece of this is cost, and I think judges have no concept of that. And you may not know that Director Dorfmeyer attends a Zoom coffee with judicial leaders, so the judges who chair each of the juvenile committees for the state. And we just have coffee and talk about ideas. And this came out of one of those. So we asked, can you give us some idea of what these services cost? We'd love a bench card. So, when we're looking at different alternatives, we can look at, does this cost $300 an hour or is it $50 an hour? And that's, of course, not going to make the decision. But it is a factor that is a consideration that needs to be on the table. Yeah. So I think we are moving in the right direction. Right child, right services, right time, right amount, all of these things.
Yeah, this may be a little bit beyond the scope of what you were looking at in terms of the services, but did you consider or look at the role of aftercare services following residential?
That hasn't been a theme to this point that came up. Really, the only thing I can recall that came up residential was more a child who was in a residential placement, and we had community-based services layered on top. But at this point in time, no, aftercare hasn't been something that's popped up as a theme in the cases we've pulled.
So I bring that up because what we see as a residential provider is a remarkable range of aftercare. Sometimes we don't get a referral, sometimes we do, and it extends for the 6 months. Sometimes it's closed for no reason that we can discern. And then we really view aftercare services as prevention for the next episode of care. Mm-hmm. So making sure that we are doing some of the same things that some of the other home-based, community-based services like family preservation do, of making sure that if there are those supports that are needed, they're there. Mm-hmm. And we feel like we're in the best position to do that because we built that rapport with the child, with the family. And so we have hopefully some kind of rapport and consistency across that. But there are different philosophies. So some, if it is a placement through juvenile probation, they will view any further involvement beyond the release from residential as heavy-handed. And so they feel like the family and the child have done what they need to do, and so they don't want that in place. So some agencies their goal is to close that in 30 days. instead of the full 6 months.
Mhm.
So I'm just curious, that might be something that is an effective looking at which of these services are involved for kids who have been, with residential before, that maybe extending that would prevent the need for further involvement with that. And also looking at the 6 months of, is there something beyond that? So is there, kind of an extended role for aftercare in those services? So I think it might be a service that's worth considering in the universe of these kids.
Thank you.
Any other questions? Nathan, thank you.
All right. Thank you all.
All right, we're getting close to the end here. Our next two meetings, so this year will be in October, one on October 21st and then December 9th. And if you have thoughts or questions on topics and stuff, I know most of you know Hannah Joy. Hannah Joy is the director and our soon-to-be vice chair of this committee. And I'm encouraged by your participation, your involvement, the discussion that we've had, and the direction. And I'm going to ask Representative Burton to pray us out of here, if that's all right.
Sure. All right. Can you please raise your hands? Paul, thank you so much for this day. Thank you so much for this discussion. Thank you for just putting the heart of your children on each and every one of our hearts, and continue to allow us to work together to solve the problems facing our state and facing the country, and let us be a beacon of light to the families who need us the most. In my name of Jesus, I pray. Amen.
Amen. Thank you all. We're adjourned.